As we look back on our history, we see a proud tradition of exceptional patient care and continual growth.
As they celebrate their 20th anniversary, I am most proud of the SSM Medical Group's continued commitment to providing quality care to the patients that they serve. They have done a remarkable job over this past 20 years of just providing extraordinary, exceptional care to everybody within the organization and making a significant contribution to the success of SSM Healthcare.
SSM Medical Group has been around for 20 years, and I'm proud that I was one of the early members and have seen it grow and develop and go from a small pods of individual office groups now to a St. Louis network-based delivery system for both internal medicine and primary care, and now incorporating specialists.
We've gone through going from paper charts to electronic health records. We've gone from just taking care of patients in the office to having a patient-centered medical home where we take care of the entire patient.
The way that the medical group has expanded in just the past 5 years to now include most all of the specialties in medical care is really putting us in a position that we can adapt to the changes that we're going to see in medical care over the next 10 or 15 years.
With all the changes that have happened at SSM over the last 20 years, one thing has not changed: our commitment to providing the best patient-centered care possible.
I believe that patients today, more than ever before, want to be a real partner in their health care maintenance and their health care restoration.
And they're much more proactive in their health care choices. I think as a physician, my role is to lead them through these changes.
Patients need to feel that they can reach out to their physician and ask any other questions that they weren't maybe able to think about in the room. And I think that's what makes a physician within our system very accessible. We have ways to do that within MyChart and then through our EHR system, that the appointment doesn't end just at that office visit.
I think the end result is a patient experience where they want to come back, stay with SSM, and send their friends and relatives to SSM. That is the ultimate compliment. The greatest compliment a physician can have is for a patient to send them another patient.
I want a patient who's engaged, happy with the experience, and eager to come back. Somebody who, when we measure patient satisfaction, says, that's the doctor and that's the office that I want to go to.
Since its beginning, SSM has been a nonprofit, faith-based organization built on a simple but profound mission statement.
Through our exceptional healthcare services, we reveal the healing presence of God is a group of words that, when embodied, really do form the basis of all of our decisions going forward.
I look at that mission statement every morning when I walk in my office, and it's very, very important to me that that is what we are trying to do.
We're not just about making a profit. We're not just about building a new building. We're about trying to put something back into the community.
That's what keeps me here. This is not a business, this is a passion.
As SSM becomes a more integrated medical group, we see benefits for both patients and physicians.
I don't think I would be able to do the job that I feel like I needed for my patients if I wasn't part of the larger organization, and SSM has allowed me, I think, to become the best physician that I can be.
In the old days, it would take a week or two before you got a letter from one of the specialists. Nowadays, I can see the actual office visit the same day that the patient was there. I can actually see what kind of tests they've done, and I can also see results of tests they might have ordered.
I think that when a primary care physician like myself builds a strong relationship with a specialist, cardiologist, nephrologist, pulmonologist, and you typically converse with these physicians a lot, you get to know one another personally very well.
I am practicing in a high technology available office, providing technology in ways that I could never do when I was in a private practice setting.
With a strong past and a bright future, SSM will meet the changes and challenges we face as a team with a shared vision.
As excited and proud as I am about where we've come from, over these next 20 years, I'm even more excited about the direction healthcare is going. The shift from occasional illness and coming to the doctor when you're sick to population management, wellness, preventative services. What an exciting time for healthcare, and what an exciting time for the medical group.
My own personal opinion is that the future of medicine the future of healthcare is very bright because we are continuing to have new discoveries, new treatments, new understandings of disease. And if we continue on the line that we have been on since I've been in practice, you can't help but be excited about it.
We incorporate all the new science and technology of the future, but we'll never lose the connection that we have with our patients, the old-fashioned connections that physician and patient have always had. We care about the people we serve, and we care about each other. We are an excellent team, and we represent the best of healthcare.